There, I guess we're live on the YouTube. Boy, do I have a lot of information to cover with you tonight. Thanks for being with me. It's dark outside. I got here at 7 this morning. It is currently 6:15 in the evening. It's been a long day, but boy, a lot of things have happened in the news today that I want to cover with you because it has to do with Medicare and seniors and sometimes actually their livelihood. So I'm hoping that this thing is actually working. I'm going to cover tonight another hospital system has announced that they are dropping Medicare Advantage. What is that going to do for thousands of people who are counting on it? We'll find out. And then an update on the California situation. Turns out it's a lot worse than I originally thought. I'm going to bring that to you. And you're saying to yourself, well, I don't even live in California. How does that affect me? You'd be surprised because it really does, no matter where you live in these United States. The American Hospital Association has weighed in on Medicare Advantage just today, right before 5 p.m. I'm going to share with you some of the specific things about Medicare Advantage that they're reaching out to CMS, the Center for Medicare and Medicaid Services, asking for their help to help regulate Medicare Advantage. I've got the details here. You will want to see them because these are your hospitals out there trying to defend you. You'll see that and you'll be amazed. Just today, an hour ago, Representative Katie Porter interviewed Wendell Potter. Wendell Potter used to be a Medicare Advantage executive working for two different insurance companies, Humana and Cigna. Now he's speaking out about Medicare Advantage. He's got some new information about that. The two of them spoke together for a few minutes. I've got that full interview for you at the end of today's broadcast. Don't miss that. And then Cigna Medicare Advantage is making a move. What's going to happen to that if you happen to be on Cigna Medicare Advantage? So today, first, it just broke in the news. Memorial Hermann Hospital Network drops the Humana Medicare Advantage program. It's a Houston-based big outfit, will no longer have Humana in its network. Now remember, in case you're not aware, your Medicare Advantage plan is a one-year finite contract from January 1 to December 31. That is the contract that you have with your health plan. However, they have contracts with providers that have nothing to do with your contract with the health plan. So providers can come and providers can go. I mentioned yesterday we had a client that was on a Medicare Advantage plan that they picked during the annual election period for January. Before January even got here, they found out that all the doctors, 3 in fact, had left the Medicare Advantage network because they didn't want to be a part of it for the new year. So thankfully, we can scramble and put them on a new plan. This 17 hospital system told the Houston public media that it continues to participate in Humana's commercial network, commercial plans like employer plans, individual health insurance under Obamacare. Humana told the outlet that its Medicare Advantage members who are actively receiving treatment at Memorial facilities can continue care until treatment is completed, if you're currently in treatment. In November, Memorial Hermann issued termination notices after the reimbursement dispute came to an impasse. Same thing we talked about in the last one, another whole hospital system. It's about the reimbursements. They're not paying as much for the commercial as they're doing with the commercial on Medicare Advantage. That's a problem that puts seniors in the crosshairs. Along with its hospitals, Memorial has 6,700 affiliated physicians across 260 care delivery sites. You think that's going to impact some seniors? Just a few. Humana is the country's second largest Medicare Advantage insurer. At least 15 hospitals or health systems nationwide. Imagine that. 15 hospital systems nationwide have dropped some or all contracts with Medicare Advantage plans just in 2023. If you don't think this is a significant growing problem, you're wrong. Citing excess prior authorization denial rates, we talked about last time, or slow payments from insurers. While the trend is not an occurrence in the majority of the nation's health systems, hospital executives and state associations have been more candid recently with their critiques of the program being Medicare Advantage. Several health systems are also expanding their own Medicare Advantage subsidiaries. Yeah, these hospitals, they want to have their own Medicare Advantage plan because they can have their cake and eat it too and participate in the profit, which is what Medicare Advantage is all about. So more and more hospital systems are being affected. As more are announced, I'll continue to bring them here, which is why you should be subscribed to find out what's going on because Medicare is changing all the time. Talk to you about California's system where Governor Gavin Newsom 2 years ago, which just became law a couple days ago, passed that everyone coming in, now up to the age of 49, soon it'll be all of them, of the illegal aliens that come across in California can have free health care courtesy of Medicaid through the state of California. And many comments after that were like, that's no big deal. It's just the state of California. And Medicaid is not Medicare. It doesn't affect me. Why should I be concerned about it? Here's why. If you look into the details, who is it that pays the bills for Medicaid in the state of California? I looked into it 2 years ago. Let me zero in on this so you can actually see it up close. Medi-Cal funding sources. In fiscal year of 2021 to 2022, Medi-Cal was financed 70% by the federal government. Who is that, you might be asking? Well, that's you and me with our tax dollars. I paid a lot of taxes last year. This is where it's going to be going now. Wait a minute, that's just last year. What happened? That was 2 years ago. What happened now? Glad you asked. This is about the governor's budget for 2023, 2024. Oh, wait, no, that's not the one yet. I just wanted you to see graphically what this means. This is the percentage of federal funds being used for Medi-Cal last year. The vast majority of the funds used to pay for this, this is only, I mean, at the flick of a switch, January 1, 2024, this now impacted 700,000 new illegals with zero copays, zero restrictions whatsoever, as long as they're going through Medi-Cal in the state of California. Yeah, that probably should get everybody up in arms because we are all paying for that decision. Thanks, Gavin. Now, in this very illuminating letter that was written today, this is timely, folks. All this stuff's happening just today. I'm glad somebody's watching what's going on with Medicare, yours truly. This is a letter to the administrator of the Health and Human Services Division of CMS, Center for Medicare and Medicaid Services. They oversee Medicare. If you're not familiar, if you're a first-time subscriber, Medicare CMS is proposing a new rule with sweeping changes, but they want your comments on that. Actually, it ends today for the comment period. They'll be ruling on this soon. Now, this is nothing passed by Congress, which really shocks me. It's not a law, and you'll find out what the Congresswoman says about Medicare Advantage in just a minute. No, this is just the regulators at CMS in their arbitrary wisdom on their own enacting a law that will impact you. Some of these proposals are good. Some of them may be bad. We're going to find out about it as I pull it up and go into detail. Let's see what's in that letter. Here's the letter. And I had it highlighted in here somewhere. The benefits of going live. Do I have it here? Yes, I do. Well, let's look at it in the highlighted version where you can actually see it, because some of this stuff is kind of startling. And you have some people on the interwebs talking about Medicare Advantage and some people who are just saying, I don't think it's a good thing. Why is that? Here are some illuminating details from all the doctors that run the American Hospital Association. They say about the new proposed rule, the AHA applauds CMS for this proposal to align MA, they call it, Medicare Advantage, and traditional Medicare appeal rights more closely. This is just one aspect of the whole thing. Now, if you have Medicare Advantage, you can appeal because the denials are routine. You can appeal those, but what happens? Do you get the same benefits on appeal as you would if you're on original Medicare and something went wrong? No, you don't. See, most of my sales friend agents that are selling Medicare Advantage have this constant lie going on that says Medicare Advantage is just as good, but better than traditional Medicare. It's bull honky, and I'll show you another example of that right here. The American Hospital Association, along with a chorus of other stakeholders, I'm one of them, and government agencies, has urged CMS in recent years to address disparities in access to care for Medicare Advantage beneficiaries, including, and most significantly, as in the Senate hearings we showed on this channel, post-acute care services, where the denials and kicking you out of skilled nursing after recovering from something major in the hospital is routine with Medicare Advantage. This rule took important steps, the last one, to address many of these issues, and we believe creating uniformity in appeal rights for Medicare beneficiaries when home health agencies, skilled nursing facilities, services are terminated would be a further beneficial step. Well, what are you talking about? What's wrong? Why is there no parity right now? Well, I'm glad you asked the question. Let me get a little bit closer. Remember that commercial? Get a little bit closer with Air It Extra Dry. In addition, we support CMS's provision to eliminate current rules that require automatic forfeiture of appeal rights for Medicare Advantage enrollees upon leaving a facility or ending services. So if you're in a skilled nursing facility and you're appealing the fact that they're kicking you out and you go ahead and leave, you don't stay there to stand your ground, signing the form that says you understand your Medicare Advantage plan is kicking you out because some artificial intelligence told them you shouldn't be here anymore. If you go ahead and leave when they tell you to leave, you forfeit all of your rights to the appeal. They think the appeal is just done. So what do you have to do, as we've showed in countless cases before? Pay for it out of your own pocket. Does that go toward your maximum out of pocket? No, it doesn't, because it's not sanctioned by your plan. So if you leave the facility or you end your services and you go along with their termination of you, you just waive your appeal. You're done. There are many complicated steps involved in fighting an inappropriate termination of services, and patients can be faced with an unknown financial liability if their insurer refuses to pay for their care. Remember, this is only about Medicare Advantage, prompting some patients to leave the facility or otherwise discontinue services before they are medically ready. This is not anecdotal, people. This is happening on a mass scale. This is an impossible situation for patients and families when their medical team, the doctors on the ground, have indicated it is not safe for the patient to be discharged home yet or home without home health care services. But the patient's insurer has indicated, Medicare Advantage, they will not continue paying for covered services in a facility or provide support at home through a home health care agency. Patients should not be penalized in these circumstances and should maintain access to their full set of appeals, whether they opted to remain or not in a post-acute care facility when faced with coverage termination notice from their insurance company, Medicare Advantage. This is especially important given reports from the U.S. Department of Health and Human Services of Office of Inspector General, which we've covered before and you can download from our website, highlighting, quote, high overturn rates of appeal denials and widespread and persistent CMS audit findings about inappropriate denials, which raise concern, the study said, that some Medicare Advantage beneficiaries and providers were denied services and payments that should have been provided. If you're wondering if you can read this without my commentary, absolutely. The link is in the description below in full transparency. I do the research, you get the benefits. Accordingly, we strongly support CMS's proposed updates to strengthen member appeal rights and ensure that patients do not forfeit certain rights in the wake of an insurance company's termination of their services. Lastly, we encourage, this gets much better. Don't go anywhere. It gets better. Lastly, we encourage CMS to consider applying the same protections and appeal rights described above more broadly and extend these protections to hospital provider types, including short-term acute, inpatient rehab, and long-term care hospitals. The same rationale for the above provisions for non-hospital providers also applies for appeals of inpatient hospital services. If they're trying to kick you out of the hospital on Medicare Advantage, you should have the right to appeal. Here it goes. Specifically, both traditional Medicare and Medicare Advantage beneficiaries have a right to appeal when a quality improvement organization, when a hospital or MA plan, respectively, determine that inpatient hospital care is no longer necessary. However, this is a big however. However, while a traditional Medicare beneficiary or with a Medicare supplement can have a quality improvement organization review an untimely appeal, that means you already left, a Medicare Advantage beneficiary who has their services terminated by the Medicare Advantage plan can only have the untimely appeal heard by the plan, only by the plan. Who can you appeal to? Only to the plan. It's written in their contract with Medicare. The first right of refusal is with the plan that just terminated you and kicked you out. You can appeal to them. What do you think they're going to say? This is the specific issue that CMS seeks to correct in creating parity in appeal rights between traditional Medicare and Medicare Advantage for skilled nursing facilities, home health care, and core services. And we believe the same rationale would apply to inpatient hospital services, including short-term acute, inpatient rehab, and long-term care. Therefore, in bold, the American Hospital Association encourages CMS to take an analogous step for appealing terminations of inpatient hospital services to ensure Medicare Advantage beneficiaries have the same appeal rights as traditional Medicare beneficiaries because they don't right now, where coverage of inpatient hospital care is terminated by a Medicare Advantage plan. Specifically, the American Hospital Association recommends that CMS modify its regulations, because it ain't even proposed yet, to ensure that quality improvement organizations also review untimely appeals of Medicare Advantage termination notices of the inpatient hospital services. There you go. They just want it to be fair. If all of you are saying that Medicare Advantage is just as good as original Medicare, why won't you let them appeal to a Medicare organization instead of just to yourselves? Improving access to behavioral health care. This is one of the ones that they did bring up in the congressional hearing, how they have these ghost networks where the Medicare Advantage plan will say, all these providers for mental health are in your network. Then you find out that you can't get an appointment with any of them. They're not even in the network, or they won't take you anymore. The American Hospital Association applauds CMS's attention to gaps in access to behavioral health services, including its consideration of more rigorous network adequacy standards as one tool to improve Medicare Advantage patients' access. Coupled with other efforts, notably those to increase the behavioral health workforce, stronger network adequacy standards likely will reduce the volume of delays and denials that they currently have for behavioral health coverage under Medicare Advantage. That'll hopefully be a good thing. They cite some specific examples of what they want in there. Data integrity. American Hospital Association members, those are doctors, by the way, have reported concerns with how certain Medicare Advantage plans handle member appeals in a manner that appears designed to shield from independent review and CMS oversight. Well, isn't that something? Which underscores the importance of the provisions for consumer protection and insurer accountability. For example, let me give you an example. Members have shared examples with us of several large Medicare Advantage plans unilaterally deeming member appeals invalid or converting medical necessity appeals filed on behalf of patients into provider disputes, therefore circumventing plan obligations to report these appeals to CMS. So they're basically hiding these appeals so CMS doesn't know about them. They're saying it was a provider dispute. It was your member problem with your provider. It's not with us, it's just with your provider. And blocking access to essential data and on plan appeals that impact the calculation of plan star ratings. See, if I call you having a problem with your provider, I'm just not going to have that held against me in my star ratings. That needs to be changed. And here, for my agent friends that watch, I wonder how many agents are watching, and as opposed to real people that are on Medicare, talking about the new rule that all the agents are upset with, proposed by CMS, to come after agent compensation, where agents are paid sometimes like under the table with sidewise ways of paying you on the side instead of with what's been authorized by CMS, which is already more than double what we get on Medicare supplements, because I'm an insurance broker, happen to know if I write you on a Medicare Advantage plan when you're new to Medicare, I make more than double what I would have made if you got on to a Medicare supplement plan and kept your traditional Medicare. That's why they call you every 5 minutes to get you on an Advantage plan, which is illegal, by the way. Turn them in. The American Hospital Association. CMS proposes new guardrails for plan compensation to agents and brokers in response to the agency's concern about consumers being steered to plans that may benefit an agent financially, but may not be the best option to meet the beneficiary's coverage needs. Saying ain't so. We strongly support CMS's efforts to advance consumer protections and ensure that seniors have access to accurate and complete information. The problem is agents don't talk about staying on traditional Medicare with a supplement. They just want that money for that free plan because it's so easy to sign people up. Hey, just say I agree on this phone. You said it, good, you got a free plan. I got some bank. That's not complete information about their Medicare options to enable informed decision-making about coverage. Hospitals and health systems nationwide, what do they encounter? They regularly encounter Medicare beneficiaries, and I know this is true because we talk to them every single day. They had no idea what they were doing. They encounter regular Medicare beneficiaries who do not understand their coverage or benefits, or who may have been enrolled in an Advantage plan without fully appreciating their options or the potential implications of opting out of traditional Medicare coverage. The lying, sneaky agents out there will tell you that you're still on Medicare. You're just on a special part of Medicare that has freebies. It's a lie from the pit of hell. You're not on traditional Medicare when you sign up for a Medicare Advantage plan. You are literally signing away your Medicare plan, and you can put your red, white, and blue Medicare card in the safe because it's no longer good for the plan year on which you're on the Medicare Advantage plan. Probably shouldn't have said that. The potential implications for opting out of traditional Medicare. We've also heard from some members, you all are commenting like crazy, and I'm going to bring them into the live stream in just a second. Keep it coming. We've also heard from some members that they occasionally work with patients who report being unaware that their coverage was switched from traditional Medicare to coverage through a private Medicare Advantage plan and believe this was done without their consent. Say it ain't so. And we need CMS to crack down on this. You've got rules against it right now. How about enforcing those rules and kicking some agents out of the program? Take their licenses from them. Find these agents who are doing it. They're doing it blatantly right in the public view all the time. You can see the enrollment records. You can see the complaints coming from the same people. Do something about it. Somebody protect the seniors. With this in mind, we fully agree that more oversight is needed. Though they can see it, they're just not enforcing anything during the plan selection and enrollment process to ensure prospective Medicare beneficiaries are receiving accurate and comprehensive information about their Medicare options. Seniors should be able to trust that information or counseling provided to them about plan options is not perversely linked to financial incentives or bonus structures. Amen. The proposed provisions, see, I would have edited that out if this weren't live. The proposed provisions to standardize compensation structures and prohibit commission or volume-based payment incentives that may result in efforts to improperly sway enrollment are an important step to protect consumers. I highly agree. And CMS hopefully will get in on this program and actually start enforcing it. Thank you to the American Hospital Association for what you've done. I think it's fantastic and it's commendable. Now, study just came out today, January 5th, as I'm live with you now. Older Americans say they feel trapped in Medicare Advantage plans. What's that all about? This is from what's formerly known as the Kaiser Family Foundation, the nonprofit research arm that does a lot of healthcare study. It's nonprofit, which is really cool. It's no longer affiliated with like the other Kaiser. Now they've called themselves KFF News. If you're not yet subscribed to this channel, you really, really, really should be. Why? Because we update you on all things Medicare and things are changing all the time. Subscribe and tell somebody that's on Medicare. Would you please? Let me read this to you because it's fascinating. What about seniors being trapped on Medicare? In 2016, Richard Timmons went for a free informational seminar to learn more about Medicare coverage. What do you think those options are going to be talking about? I listened to the insurance agent and basically he really promoted Medicare Advantage, Timmons said. Oh, and by the way, if you don't agree with my commentary, don't know if it's accurate, you can actually see the original text in the description below. The link to it just came out today. The agent described less expensive and broader coverage offered by the plans, which are funded largely by the government but administered by private insurance companies. For Timmons, who's now 76, that's what he looks like. Cool dude. It made economic sense because it's no premium. It's free. Made economic sense then to sign up. And his decision was great, as it always is, for a while. Then 3 years ago, he noticed a lesion on his right earlobe. He's a retired veterinarian, by the way. He knows a little thing about medicine. Quote, I have a family history of melanoma, and so I was kind of tuned into that and thinking about that, Timmons said of the growth, which doctors later diagnosed as malignant melanoma. It started to grow and then started to become rather painful. Timmons, though, discovered that his enrollment in I'll leave out the name of the plan, it's just a Blue Cross Medicare Advantage plan, would mean a limited network of doctors and the potential need for pre-approval or prior authorization from the insurance company before getting care. That's what he discovered. The experience, he said, made getting care more difficult, And now he wants to switch back to traditional government administered Medicare. That's what another study showed, is that the vast majority of people who have massive things going on, they want to jump back to original Medicare. What does that do? It leaves more profit behind for the people who are just dandy until something goes wrong. But he can't, and he's not alone. Quote, "I have very little control over my actual medical care," he said, adding that now he advises friends not to sign up for the private plans. Quote, "I think that people are not understanding what Medicare Advantage is all about," end quote. Enrollment in Medicare Advantage plans has grown substantially. Of course, we all know that. Enrollees like Timmons who sign on when they are healthy can find themselves trapped as they grow older and sicker. Quote, "It's one of those things that people might like them on the front end because of their low to zero premiums. And if they are getting a couple of those extra benefits, the vision, the dental, that kind of thing," said Christine Huberty, whose testimony before the Senate was awesome. And you can find that on this channel. She's a lead benefit specialist supervising attorney for the Greater Wisconsin Agency on Aging Resources. She is awesome. Quote, she said, but when they actually need to use it for these bigger issues, that's when people realize, oh no, this isn't going to help me at all. Medicare pays private insurers a fixed amount per Medicare Advantage enrollee, and in many cases also pays out bonuses, which the insurer can use to provide supplemental benefits. Huberty said those extra benefits work as an incentive to get people to join the plan, but that the plans then restrict the access to so many services and coverage for the bigger stuff. David Myers, assistant professor of health services policy and practice at Brown University's Public Health School, analyzed a decade of Medicare Advantage enrollments and found that 50% of beneficiaries, rural and urban, left their contract by the end of 5 years. Most of those enrollees switched to another Medicare Advantage plan rather than traditional Medicare. In the study, he and his co-authors mused that switching plans could be a positive sign of a free marketplace, but that it also could be a signal of unmeasured discontent with Medicare Advantage. The problem is that once you get on a Medicare Advantage plan, if you have a couple of chronic conditions and you want to leave Medicare Advantage, even if Medicare Advantage isn't meeting your needs, you might not have the ability to switch back to traditional Medicare. Not true if you have a broker who knows what they're doing. Hello. Traditional Medicare can be too expensive for beneficiaries switching back from Medicare Advantage, he said. In traditional Medicare, enrollees pay a monthly premium for Part B, and after reaching a deductible, in most cases are expected to pay 20% of the cost of each non-hospital Part B service. That's doctors, ambulances, outpatient things. And there is no limit. That's true. There's no limit on how much an enrollee may have to pay as part of that 20% coinsurance if they end up using it a lot, Myers said. To limit what they spend out of pocket, traditional Medicare enrollees typically sign up for supplemental insurance, such as employer coverage or private Medigap policies. If they are low income, Medicaid may provide that supplemental coverage. But Myers said, there's a catch. Dun, dun, dun. While beneficiaries who enrolled first in traditional Medicare are guaranteed to qualify for a Medigap policy, Medicare supplement, without pricing based on their medical history, Medigap insurers can deny coverage to beneficiaries transferring from Medicare Advantage plans or base their prices on medical underwriting. Doesn't happen very often. Only a few companies rate up. It's either usually pass or fail. That's why it's good to have a Medicare insurance broker who does not work captively, it's not even a word, as a captive agent for only one insurance company. They should be a broker that have access to all of them. By the way, our service is free, and we know all the companies out there. So it kind of helps if you have a unique underwriting situation, right? I'll give you a link in a little bit as to how you can see how the underwriting works and whether or not you would pass. Only 4 states, Connecticut, Maine, Massachusetts, and New York, prohibit insurers from denying a Medigap policy if the enrollee has pre-existing conditions such as diabetes or heart disease. Paul Ginsburg is a former commissioner on the Medicare Payment Advisory Commission, also known as MedPAC. They do some really good work. They advise Congress every year on this kind of stuff, some really good studies. It's a legislative branch agency that advises Congress on the Medicare program. I just said that. I hadn't read this before because it just literally came out. He said the inability of enrollees to easily switch between Medicare Advantage and traditional Medicare during open enrollment periods is a real concern in our system. It shouldn't be that way. The federal government offers specific enrollment periods every year for switching plans. During Medicare's open enrollment period, it's really not open enrollment. It's from October 15th to December 7th. Enrollees can switch out of their private plans back to traditional government-administered Medicare. Medicare Advantage enrollees can also switch plans or transfer back to original Medicare during another period, January through March 31st each year. There are a lot of people that say, hey, I'd love to come back, but I can't get Medigap coverage anymore, or I'll just have to pay a lot more, said Ginsburg, who is now a professor for health policy at the University of Southern California. Timmons is one of those people. Remember the veterinarian? The retired veterinarian lives in a rural community in Whidbey Island, just north of Seattle. It's a rugged, idyllic landscape and a popular place for second homes, hiking, and the arts. That's important. But it's also a bit remote. While it's typically harder to find doctors in rural areas, Timmons says he believes his Blue Cross plan made it more challenging to get care for a variety of reasons. Wait till you hear the Congresswoman's example about her own father in this interview that I'll play for you in just a second. It's revealing. Same situation, cancer and specialty, including the difficulty in finding and getting into specialists. Nearly half of Medicare Advantage plan directories contain inaccurate information on what providers are available, according to the most recent federal review. Beginning in 2024, new or expanding Medicare Advantage plans must demonstrate compliance with new network expectations, or their applications could be denied. Amanda Langsford, here we go, a spokesperson for the Premier Blue Cross, declined to comment on this case. She said, our plan meets federal network adequacy requirements as well as travel time and distance standards to ensure members are not experiencing undue burdens when seeking care. Let's find out what happened to Timmons. Is he experiencing unusual network adequacy requirements and his standards of care being okay and undue burden? I hope not. Traditional Medicare, on the other hand, allows beneficiaries to go to nearly any doctor or hospital in the U.S. Is that true? Yeah, it is true. And in most cases, enrollees don't need a prior approval to get services. That's true too. No prior authorization, no referrals required. Go, 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 wherever you want to go. Back to Timmons. Timmons, who recently finished immunotherapy, said he doesn't think he would be approved for Medigap policy because of my health issue. If he were to get into one, Timmons said, it would likely be too expensive. You're right, you can't. Unless, for now, Timmons said he's staying with his Medicare Advantage plan. I'm getting older. More stuff is going to happen. Does that happen? Sure does. The warranty on hips and knees and all those kind of things just kind of expires in your 70s. There's also a chance, he said, that his cancer could resurface. I'm very aware of my mortality. Is it life and death? Is it traumatic to talk about this in life or death terms? No, it's not, because it is. It is life or death. If they say no and you can't get the treatment and you can't pay for the full retail price of the treatment without Medicare's discounts because you're not on original Medicare anymore when you're on a Medicare Advantage plans, then what are you going to do? Are you going to do like they talked about in our last case last week? They're just going to sell your house and then go get the treatment, then appeal, then get denied and appeal again, the 5 layers of appeal, which could take over a year and a half. I'm going to play you this interview, but it's a few minutes long. I want you to hear what happened to Congresswoman Porter. If you don't like her politics, I don't care. She tells the truth in here about Medicare Advantage as she's talking with Wendell Potter, the former executive from 2 Medicare Advantage plans. You need to hear this interview. What are other people saying? I'll just skim through this because it's self-serving. But these just came in, and I want you to see what people are saying about us in case you don't have the time or the energy to do research about who you should do business with in the Medicare space. This person just wrote this week. This is completely unsolicited. We didn't pay for this. I just found it because I got an email about it. I couldn't think more highly of an experience with 𝗍𝗍, one of our agents in here, and the Senior Savings Network. Prior to my decision to go with 𝗍𝗍 and Senior Savings Network, I sadly wasted time in meetings with 4 other Medicare consultants and organizations. They either knew less than I did after a couple months of self-education, being on this channel, hello, or they had an ethical challenge as they pushed ill-suited products. That's a nice way of putting it. Looking for higher commissions. You betcha. The experience with 𝗍𝗍 and Senior Savings Network was even better than their fantastic YouTube videos. Oh, and I'm just so thoroughly happy and satisfied to have worked with them. Sincerely, thank you, and thank you, Ken. Somehow this got slipped in there, but I'll just tell you about it anyway. Cigna is in talks with another Blue Cross Blue Shield association to sell their Medicare Advantage. They want to get out of the Medicare Advantage plan. They want to extend it. The company that currently owns 5 Blue Cross Blue Shield carriers with nearly 18 million members in these states is in talks to buy them. It has to get regulatory approval. Here's another Better Business Bureau thing, because when you go live, sometimes things just get out of order. This person said, we have watched many of the videos by Chris Westfall. Finally, we called to check on our plan. And with the help of Noel, who's on vacation in Nashville this week, hope you're having fun, Noel, we qualified for a new plan and saved quite a bit of money. People don't know that when you're on a Medicare supplement plan, the rates go up typically on your policy anniversary, and you can shop that rate with a new broker who has access to a whole bunch of companies and can save you money. You may be on the right plan letter, but the wrong company. That's what this person did. We scheduled an appointment with her twice, and both times she called the exact time she had promised. We appreciated all that Noel did for us. Once, while Noel was out sick, she was really sick, she had Gabby call to follow up with us. Yay. I believe this is a continuation of Judy's. I believe that helping seniors and selling Medicare insurance are two passions Chris and his team. They could make more commission selling Medicare Advantage, but they know that is not best for most seniors. We'll talk to you about it. We'll show you the options, and we can enroll in it, but we're going to be honest about it. It's nice to throw our business to a company like this. Thank you, Judy, so much. Last one I'll go over. Great company that went well above and beyond and helped me. Alexis was another great agent. Walked me through the process and made sure that I understood everything. This company is a breath of life in a world full of evil, lying, money-grabbing crooks. They tell the truth and let you make the decisions. Love this company for sure. That's awesome. Just to go over real quick with you so you know, because I want you to be fully aware of your options, different time frames as it proposed, as it is with Medicare Advantage. October 15th to December 7th, you can change those plans or sign up for one or drop it. That becomes effective January. But January 1, your new coverage started. But January 1 to March 31, you can change Medicare Advantage plans. If you found one that you don't like, or you just did it on your own and you didn't get anybody's help, and you probably should have, you can look at those options during this period of time. And whatever you do during this period of time takes effect on the 1st of the next month. So if you sign up for a new plan in January, new Medicare Advantage plan, or you decide to go back to original Medicare, don't do that without doing it in the right order, by the way, which we can help you with. Where can we help you with that? Oh, this website, seniorssavingsnetwork.org. Don't go anywhere. I know you want to click off, but don't do it, because you're going to see this interview and it's going to blow your mind. Go to our website, click on the Medicare Help button. We describe what all the options are, and you can watch a video going into detail about how we can help you, whether you want a supplement, whether you want an Advantage plan, when you compare the two. If you have one of those handy dandy smartphones, you can, if you get the big head out of the way, you can scan this with your cool phone. It'll take you right to that page and save you a lot of time. And you can pause it here and come back to it if you want to. That's how we can help. But I want you to see the interview with Katie Porter. And I'm going to look at your comments and start putting them in. So here it is, the interview you've all been waiting for.
When you get sick, you go to the doctor, you get treatment, Medicare pays. Medicare Advantage, let me ask you the most basic question. Why would a huge health insurance company, let's use United Healthcare, why would they offer Medicare Advantage plans?
A lot of profits. It's become their biggest cash cow in many cases. They get even more money from the Medicare Advantage program than they do from the commercial health insurance plans, because...
No, wait, you're saying Medicare Advantage is even more profitable than traditional health insurance?
Oh, absolutely. Oh yes, for sure. It's a lot more profitable because they figured out how to rig the system, how to try to convince the government that the people who enrolled in their plans are sicker than they really are, and the government pays them more because of that. They've been paid billions and billions of dollars more every year than they're entitled to.
And you don't have to take just Wendell's word for this. This has been front page news on the New York Times, on the Wall Street Journal. Virtually every paper has said this is happening to the tunes of billions and billions of dollars. All right, let's talk about administrative expenses. Traditional Medicare spends about 1.3% of its money on administration. So think about the processing the claims and the cutting the checks or sending the deposits. What does Medicare Advantage spend in terms of administrative costs?
Oh, it's far more than that. It's about 17%. And a lot of that includes profits and pay to the big CEOs, the CEOs of these big companies and their top executives.
And in a hearing that we had about Medicare, I actually demonstrated this using dollar bills. So if I pay my insurance company $100, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, $17 go to administrative costs. Okay, now Medicare Advantage is very quick to tout its benefits. And it's true, there are some things that Medicare Advantage can provide that traditional Medicare doesn't, but people need to look at the whole picture. So let's talk about this when it comes to prescription drugs. For traditional Medicare, is it right? Is it alphabet soup here of Medicare? But I need to go get something called Part D, is that correct?
That's right. Part D, you have to buy separately if you have Medicare, and that's an expense. It is. Medicare Advantage plans do incorporate a prescription drug benefit.
So it's included.
Yeah.
Supplemental, this usually refers to things beyond the traditional doctors and healthcare.
Right.
So the big ones that I think I hear about and I fought to try to expand traditional Medicare to cover are vision, dental, and hearing.
Very important.
Does every Medicare, some Medicare Advantage plans include those things? Do they all include all of it? How good is that coverage?
You have to check because it's hard to determine exactly how valuable those benefits are. And not all of them offer those extra benefits. Most of them do, but you might find that in many cases they're just discounts or not very good coverage, and that's particularly true for dental insurance. You are going to be likely paying a lot out of your own pockets. They advertise them heavily, as you mentioned, because that's a big selling point, but seniors should know that in many cases those benefits are very paltry.
And so like I could have a very high copay,
yes,
or have very limited, so maybe I have dental but it only covers a couple $100
that's right,
worth of services, and I would still be winding up out of pocket.
Yeah.
Okay, so it's again I think really important when you're dealing with Medicare Advantage to remember you're dealing with a private health insurance company. So you should approach advertisements, you should approach their pitch with the same skepticism you would use when you're buying a used car, which is to read the fine print, really assess the claims that are being made.
Exactly.
If the government tells you that something is included, it doesn't have any incentive because there's no profit motive to mislead you on it.
You're right, and I think we're getting down in the category here of the things they don't tell you about in those advertisements.
And these are big, and these are really personal to me. My dad has a rare form of cancer, and his oncologist, my dad is over 65, and he got a Medicare Advantage plan. He didn't ask me. He got what I call Medicare Disadvantage. And when he got this rare form of cancer, his oncologist within his limited network, which is what comes with Medicare Advantage, is a limited network, his oncologist had never treated this form of cancer. So I wanted my dad, we live really, my dad lives in Iowa, it's close to Mayo Clinic, it's close to the University of Iowa. These world-class facilities have oncologists who've treated his cancer, but he couldn't go.
My mom did the same thing. She enrolled in a Medicare Advantage plan. She broke her hip, needed to have skilled nursing care and rehab. The network was so bad that we disenrolled her, and she got back in traditional Medicare, which I know saved her life.
Yeah.
That happens a lot. When you get older, you'll find in many cases that the facilities and the doctors you need are just not in network. And I think people, frankly, are dying or increasingly getting out of Medicare Advantage, going into traditional Medicare in their later years, and that's costing taxpayers even more because they're going back into traditional Medicare, and these private insurers are off the hook for the rest of their care.
Talk more about this, because with Medicare Advantage, if I want to walk in and see a specialist, can I do that?
Medicare Advantage, not necessarily. You might need to have a referral. It depends on the type of plan you had. Talk about alphabet soup. You can have an HMO or PPO, and you really have to read the fine print to know whether you'll have to have a referral or not. Chances are you will, and you'll find that in many cases the doctor or hospital you need or want to go to is not in network or might not be next year.
Yeah, I think one of the important things for people to remember about traditional Medicare is there is no private insurance plan, whether it's through employers, for people who are working, or through Medicare Advantage. There is no private insurance that has the breadth of providers and the choice of traditional Medicare. So that's a very important thing that you have to think through, as you know, particularly if you live in a rural area, if you live in an area with more limited networks. So I think the point of this part is buyer beware. Understand that they're selling you something and they're getting rich doing it. They have an incentive to push the benefits and hide the restrictions, and I think Congress needs to be doing more to both reform this program, Medicare Advantage, or to eliminate it, and to make the advertising of it more clear. So one of my colleagues has a bill that would not allow private insurance companies to market these plans as Medicare because it's confusing to people. We've also had conversations about trying to expand traditional Medicare. So things like the vet dental or the vision are not pushing people to have to choose between being able to get the health care they need for their body or the care that they need for their eyes or vision or hearing.
Congresswoman, you have just introduced a bill that will address some of the problems with the Medicare Advantage program. Can you explain what the bill does and why you introduced it?
Yes, the bill is called the Medicare Advantage Consumer Protection and Transparency Act, and that's a mouthful. But what it does is really simple. It gives data to the government, requires these private companies that are offering Medicare Advantage to give data to the government so that we can figure out if they're actually following the rules of Medicare, or if they're overcharging taxpayers and if they're shorting seniors on care. We talked about how Medicare Advantage requires you to stay in network. We don't know how big these networks are. This bill would give data to government so we can see how serious those problems are. It would also increase penalties for Medicare Advantage plans that are cheating patients, because this has been ongoing for a number of years, and we need to put a stop to it, and that starts with having this stronger teeth in the enforcement piece. I asked the director of the Center for Medicare and Medicaid Services what data there is, what evidence there is that Medicare Advantage either costs taxpayers less or improves outcomes for patients. I mean, I'm willing to take either or. I think we should be aiming for both, but I asked her to tell me about that data, and do you know what she said? None. There's none. There is no data, and there's actually a lot of data pointing the other direction, that Medicare Advantage actually costs us more and produces worse patient outcomes. So I guess I really struggle, Wendell, and I think I know the answer to this, but as someone who's worked for a big insurance company and dealt a lot with Congress, why on earth does the government continue to have Medicare Advantage, to continue to expand or tweak it when it isn't making care either cheaper or better?
The reason is because they're able to spend so much money on lobbyists, on advertising. Just last year, they spent millions of dollars, largely here in Washington, D.C., trying to scare lawmakers away from even reducing some of the overcharges. And the money that you could save from these overpayments, getting rid of some of this excess administrative expense, you could easily improve to traditional Medicare. You could add dental, vision, and hearing.
Yeah.
You could do a lot.
That's what's most galling about it. I want to emphasize that is that we have the dollars in this system to deliver the benefits of Medicare Advantage within traditional Medicare if we cut that profit motive out, if we stop putting private health insurance companies in charge of our Medicare system. So let me close. If I'm watching this, or I signed up for Medicare Advantage, late night TV ads got to me, and now I'm running into problems. I can't go see the nurses or the doctors I want to see. I thought I would get my drugs covered, but they're not covered. Can people switch?
You can switch, but beware, because you can switch, but when you're first eligible for Medicare, you can enroll in a supplemental plan without underwriting. In other words, you can be guaranteed to get an affordable, for most people, supplemental policy. If you enroll in Medicare Advantage and then want to switch back, you might not be able to get one that you can afford, because then you'll be subject to underwriting. They may charge you more than you can possibly afford. So there's there.
Yeah, so I would just say to people, you're talking to two people here who know a lot about this and are pretty passionate about why traditional Medicare is the right choice for most seniors, but you're also talking to two people whose parents enrolled in Medicare Advantage. So I think it's really important that if you know someone who's approaching that age, I mean, I'm 49, it feels a long ways away, but I'm really working to educate myself to make those good decisions. So thank you very much.
Okay, there are a lot of questions that came in. Well, not a lot, a few questions that came in, and I want to address those now. I've pulled them off to the side, and let's start with the beginning. Can you switch back to regular Medicare in the next year, or am I tied to the Advantage plan permanently? The other thing that you put in there, Julie, was that you're on Medicare Advantage due to disability. Now, I've got a website that talks about this in great detail, specific to people that are under 65. It's called MedicareOnDisability.com. I encourage you to go there. The video quality is not the best. I need to redo it. But basically, if you're on Medicare due to disability, it's completely up to your state whether the state allows you to buy a Medicare supplement policy by making the insurance company sell it to you. Some states will treat you as if you're 100 years old, no matter what your age, because you're under 65 and they don't want you on their supplement plan. It's true. So sometimes Medicare Advantage is the only way. So you have to find the most appropriate plan that's most beneficial to you, depending on your doctors, your medicine, your specialists, and your hospitals. So that's something you really should get help with. And if you're on one now, of course, you can look at those options again, January through March. When you're turning 65, understand that you do have another open enrollment period. They call it IEP2, initial election period 2, when you're turning 65, and you have a complete do-over. So you can get a different Part D plan, a Medicare supplement plan, open enrollment, which means you can choose any plan letter of Medicare supplement and no one can discriminate against you. The second question was, I'm on a Medicare Advantage plan and I've had some medical issues that will most likely be putting me in a situation where I would have to go through a medical review. Let me show you where you can look at that. You can see what is involved in underwriting because we go through most, if not all, the questions. We go to a website called seniorsavingsnetwork.org/underwritten. I know it's a lot, but it's specific to that. Or you just go to seniorsavingsnetwork.org, click the green button, and it'll take you right there. You can see what underwriting looks like, what's involved. And the benefit of having access to a lot of different insurance companies is they all have different criteria. Certainly, if you're undergoing cancer treatment actively right now, no, you can't get on a Medicare supplement if you have to go through underwriting unless you're in those 4 states we talked about, Connecticut, New York, Maine, Massachusetts. But if you are through that period, some companies have 2 years post-cancer treatment, and then you can get on. Some have 3 years post-cancer treatment. Some have 5 years post-cancer treatment. It pays to know the industry. And in all the states where we're licensed from coast to coast, we know the best carriers for specific conditions. So you should be working with a broker like us. And the other question is, how do I drop Medicare Advantage? That's a really good point. If you go to our website at seniorsavingsnetwork.org, we literally have the tab called Medicare Advantage to Medicare Supplement. How do you get there? And it's a methodical, very deliberate series of steps that if you do the wrong one in the wrong order, primarily if you drop the Medicare Advantage plan without first getting an approval for the Medicare Supplement, you've done yourself a big disservice because you can't go back to a Medicare Advantage plan for the entirety of the rest of the year. Get professional guidance on that first. You'll get some underwriting questions from us or whoever you go through that's a competent professional. You'll get an approval through underwriting first, and then make it a very smooth transition into a Medicare Advantage plan into a supplement with a specific drug plan tailored just toward you and your medicine cabinet. That's the way to do it the right way, and I explain that on seniorsavingsnetwork.org. Click the Medicare Help button. The other question is, can you explain about changing Medicare supplement companies once you've been in a Medigap plan, G or N? This is highly dependent, again, on your state. A lot of states now are adopting a birthday or anniversary rule or open enrollment all the time rule. We're talking about Washington, Oregon, Illinois, new ones out there, Oklahoma. New York is wide open all the time, which is why their rates are so crazy. But so many states now, Missouri's got the anniversary rule. So many states have these new guarantee issue provisions that don't let you get a Medicare supplement if you don't have one necessarily. But if you do have one, you can downgrade. Like in California's, for instance, the birthday rule. Every year on your birthday, you have a period of time where you can go from a G to an N or an N to a high deductible plan G. You can't go up, but you can go to a level plan or under that plan without underwriting. Just understand there's always a trade-off. So in those states where you have this guarantee issue provision, the rates are typically higher. Why? Because the insurance companies have to absorb that loss. They don't absorb losses. They pass them back on to you by raising the rates for everybody. Every time there's an unintended consequence of, we're going to pass this amazing consumer provision, like New York, for instance, it jacks up the rates. They're like 3 times as high as they would be in any other state. But in most cases, in most of the other states, you do have to go through underwriting, but it's not that crazy to go through underwriting. And yes, you should be looking at Plan N if you got onto a Plan G. Why? I explained that on another one of my websites, which has the research from at least the last 5 years, when I started predicting in 2018 what was going to happen because of a law that got passed called MACRA that would take effect in 2020. And exactly as I predicted, and I categorized it or chronicled this on this website, you can see the rate increase history growing and getting massive on Plan G while staying small on Plan N, because you can't get Plan N through guarantee issue. I explain it in great detail on that website. You should check it out if you're on a Plan G or a Plan F Medicare supplement plan. Just know that we, the agents, make more money if I sign you up on a Plan G, because what we make, which is actually on this website, how do you make money? How are you doing all this stuff for free? It doesn't cost us anything to use or service. I explain that at howdoyougetpaid.com. Just go there. It'll explain how we get paid. It's just a percentage of the premium. I really enjoy doing these videos for you folks, all 200 of you that are still with us live right now. Thank you for joining us. I'm going to get out of here, go see the family, and we're going to Miami this weekend. I'm taking my wife to see the Miami Dolphins play the Buffalo Bills and hopefully get a win. She's very excited. I'm very excited to get to take her. It's going to be a good weekend for it. Hopefully no rain. God bless you. Thank you so much for watching. And if I have a little thing here, I can show where you should be looking at next. Have a great day. God bless you.